Is aripiprazole safe for children? When it comes to the safety of aripiprazole, also known by its brand name Abilify, for children, many parents have questions. This medication is an atypical antipsychotic used to treat schizophrenia and other psychiatric disorders. It is important to understand how it works and its safety profile in younger patients. Aripiprazole has received approval from regulatory authorities for use in children and adolescents. It is specifically indicated for conditions like schizophrenia, bipolar disorder, and irritability associated with autistic disorder. This approval is based on clinical studies that show it can be effective and well-tolerated in younger populations. Pharmacologically, aripiprazole acts on several receptors in the brain. It works as a partial agonist at dopamine D to and serotonin 5-HT1A receptors while blocking serotonin 5-HT2A receptors. This unique action tends to result in fewer side effects compared to other antipsychotics. Common side effects seen with other medications in this class, such as movement disorders and weight gain, are generally less frequent with aripiprazole. Clinical evidence indicates that aripiprazole is usually well tolerated in children and adolescents. Some common side effects reported include drowsiness, tremors, and movement disorders. In other pediatric groups, side effects like fatigue, nausea, and restlessness have also been noted. While these side effects requiring monitoring, they are often less severe than those associated with other atypical antipsychotics. However, it is essential to remember that using aripiprazole in children requires careful clinical supervision. Regular monitoring for any adverse effects, particularly metabolic changes and movement disorders, is necessary. This helps ensure that the benefits of the medication outweigh any potential risks. While aripiprazole is approved for specific psychiatric conditions in children, its use should be limited to these approved indications. Using it off-label or for conditions not clearly diagnosed should be approached with caution. This is due to the limited number of controlled studies available for such uses. In summary, aripiprazole is considered a safe and effective treatment option for schizophrenia in children and adolescents when used under medical supervision. Its unique pharmacological properties contribute to a lower incidence of some typical antipsychotic side effects. However, ongoing monitoring for any potential adverse reactions is vital to ensure safety in this sensitive age group.